After cancer, while you shouldn't worry that every cough, headache, or pain is a cancer recurrence, it is important to know which symptoms to watch out for so you can catch it early if it does come back. Sometimes a little vigilance can go a long way. So today we're diving into some of the most common signs that your cancer may be making an unwelcome comeback and how to know when it's time to give your doctor a call. After you finish treatment, it's normal to want to move on with your life and not have to worry about cancer anymore, right? But unfortunately, cancer can sometimes come back, whether it's months later or years down the road. You might find a lump or spot something unusual on a scan, and all of those fears you had when you were first diagnosed come rushing back like deja vu. You're scared, frustrated, maybe even angry, and rightfully so. It's okay to feel all those things. But what's important to keep in mind is that it's not your fault. Seriously, there's a whole mix of factors that can lead to a cancer recurrence. Some you can control and some you can't. It can depend on how advanced your cancer was when you were first diagnosed, or how aggressive your type of cancer is. So if you're feeling guilty or wonder what you could have done differently, let that go. It's not necessarily what you did or didn't do. What can help though is being prepared. If you know what to expect with a cancer recurrence, you can face it head on. Learn what types of treatment might be on the table for you, and how you'll manage things if the news isn't what you hoped for. You've been through this before, so you know more now about cancer, about treatments, and what helps you cope. Think about how much you knew about cancer when you were first diagnosed compared to what you know now. So let's get right into some of the most common signs of a cancer recurrence, but remember that everyone's cancer is unique, so these symptoms can look different depending on the type of cancer you had. First off, if you start to have any of the same symptoms you had when you were first diagnosed, that can be a big red flag, so don't wait to call your doctor immediately. But cancer can also show up in other parts of your body if it becomes metastatic. And here's a real bummer. Depending on where you live in the world, once you've been cancer-free for 5 years, doctors will typically stop doing any testing for cancer recurrence. I think this is ridiculous because, let's face it, if you've already had cancer, your chances of it coming back are higher. So I'm going to go over 8 common signs of metastatic cancer that you should watch out for. First up, a persistent or unusual pain. It could be anything from a dull ache, a sharp pain, or just a persistent discomfort that doesn't go away. So again, this might not be in the same place that you originally had cancer. Cancer commonly spreads to the bones, which can certainly cause pain and even fractures. So if you have a new pain that sticks around for a week or more, especially if it doesn't go away with over-the-counter pain medication, it's definitely worth mentioning it to your doctor. I once had a young breast cancer patient who about 7 years after she finished cancer treatment started having really bad back pain, and her doctor kept telling her it wasn't cancer related. So she decided to trust her instincts and get a second opinion, and sure enough, the second doctor determined that it was her cancer that had spread to her spine. So a good takeaway here is to always trust your gut instinct and advocate for your own health. Everyone is always entitled to a second opinion. Symptom number 2 to watch out for after cancer are lumps. Finding a new lump anywhere on your body is definitely something to be concerned about. Not all lumps are cancerous, but if you find a new one, especially if it's painful, don't wait to see if it goes away, get it checked out. Several types of cancer can spread to your lymph nodes, especially those in the area where you had cancer. So for example, if you feel a new lump under your arm or around your collarbone after breast cancer, this could indicate a cancer recurrence. One question I get asked often is if breast cancer can come back in the same breast, and yes, it can. So if your doctor tells you that you no longer need to be having mammograms as often because you've been cancer-free for X number of years, you still need to be doing self-breast exams every single month. This leads us to symptom number 3, which is swelling specifically in your abdomen or a pain in your right side. You see, this is where your liver is located, and it can be a sign that cancer has spread to your liver. This pain might even radiate to your back or your right shoulder and can even affect your breathing. These type of symptoms also need immediate attention. Cancers that often spread to the liver are colorectal cancer, esophageal, stomach, pancreatic, lung, and kidney cancer. So if you've had one of these types of cancer, knowing that it's prone to spreading to your liver, why not ask your oncologist about doing regular liver screenings? Screening for early detection can be especially helpful because oftentimes when cancer spreads to the liver, people don't have any symptoms at all. Moving on to symptom number 4 is difficulty breathing or persistent coughing. If you find it hard to catch your breath, have a persistent cough, or feel tightness in your chest, these could be signs that cancer has returned in your lungs or respiratory system. And yes, this can happen even if you didn't have lung cancer before. The lungs are another common spot for cancer to spread to. I had a patient recently who had a respiratory infection that wouldn't go away, and she thought for months that it was late side effects of COVID, but it turned out to be lung cancer recurrence. So please get these symptoms checked out ASAP. Symptom number 5 is unexplained fevers. A fever that doesn't have an obvious cause like a cold or infection can be a red flag. having cancer can cause chronic inflammation in your body, leading to a pesky low-grade fever that comes and goes. So I would recommend buying a thermometer and keep a record of any recurring fevers you might be having. If you're noticing them often, like more than twice a month, definitely bring it up with your doctor. Symptom number 6 is unexplained weight loss. Weight loss may sound great if you have a few pounds to lose, but if it's happening without you even trying, it could be a sign of something serious. Losing 10 pounds or more without any effort can be one of the first signs of cancer recurrence, so it's important to ask your doctor to run some tests to figure out what's going on. There are several things that can contribute to your weight loss. For example, cancer cells need more energy than normal cells, so your body may be burning more calories at rest than it normally would. Cancer cells also release substances that affect how your body uses calories from food, which can also contribute to weight loss. Also, as your body naturally tries to defend itself against cancer cells, your immune system produces something called cytokines that increase inflammation. Cytokines can actually alter your metabolism and interfere with your hormones that control your appetite, causing further weight loss. Okay, moving on. Symptom number 7, persistent fatigue. I know everyone gets tired, but this is different. We're talking exhaustion that doesn't go away with rest and seriously affects your daily life. Don't brush this off as being normal. Persistent fatigue should never be ignored. I have a video titled How to Beat Cancer Fatigue that outlines a few of the most common underlying factors for fatigue after cancer that can help you determine the root cause of it. Okay, symptom number 8 is skin changes. Now, I'm not talking about skin cancer. This is more of a sore or a wound that won't heal, or a rash that won't go away, or if a specific area of your body becomes swollen out of nowhere. These are all signs that something might be up. It can be really tough to know if any of these symptoms are actually related to a cancer recurrence or not. That's why your best bet is to always report any of these signs to your doctor. One of the biggest problems with the types of treatment that we currently have for cancer is that the technology isn't perfect yet. Oncologists can't always be 100% certain if they've removed or zapped all the cancer cells. But the good news is that the technology is getting better and better all the time, and the treatments are getting more effective. So if it's been a while since you first had cancer, the treatment technology has likely improved since. There may be newer drugs or newer methods of detecting cancer since your first diagnosis. In case you're interested in learning more about the promising changes that are happening in cancer treatment, I'll link another video below for you to watch next. But a key takeaway here is that being prepared for the possibility of a cancer recurrence can make a huge difference in how you handle things. And don't forget about your support system. Plan out who's going to get you to and from your appointments, or just be there to lean on. Speaking of support, I know that for a lot of people, even the thought of joining an online support group can seem really daunting, but hear me out. Even with the most supportive family and friends, there's something really powerful about talking to people who have already been in your shoes. It can make you feel a lot less alone, and you can even end up helping others with your story and what you've learned. But remember, recognizing the early warning signs of a cancer recurrence can make a big difference in catching it early and improving your chances of treating it successfully. If you're noticing any of the symptoms we've discussed today, don't hesitate to reach out to your healthcare team. It's always better to be safe than sorry, even if it's just to give yourself peace of mind. Thanks for watching, and I'll see you next time.